use the techniques to help? Well,
Yeah.
that depends on the goal. So if you're asking me, the kind of people that I help during the years that I did therapy were people with certain kinds of problems, drugs or family or whatever. I would use the techniques to help me help the clients. But somebody else working with different kinds of people would use it to help their patients. People who use therapeutic photography will use those techniques in the work that they're doing. And I'm being a little silly here with the answer, because what I'm trying to explain is that these are tools, they're techniques. If you want to write, you use a pen. If you want to paint, you use a brush. If you want to eat dinner, you use a fork. My techniques are tools. So when somebody is working and it's not quite enough and talking isn't sufficient, they will use photos to help any kind of person, any age, any situation, and any kind of therapy. Because they're tools, they're like, they're activities that you use when you start the helping. So in therapy, first of all, you meet the person, and then you think, okay, what is the problem that brought them here? And how am I going to help them? Well, I think they need to work on their relationship with their mother. Or I think they need to deal with this physical illness or whatever. And the trained professional, will decide what I think will help this person. When I start to do the helping, the first thing I'm going to do is talk to them. If talking is enough to solve the problem, I will not work any harder. Why use photos or art or drama or whatever if I can ask a question, they answer me? That would be just wonderful, but that is not how therapy works. It's almost never like that. Usually the person, they're hurt, their self-esteem is low, they're not so sure about, do they really want to change? And we explore these things, and the photos help me help them. It gives me a second language for helping them. And depending on their problem, a good therapist will say, okay, well, if this is the problem, then these are the kind of things I want them to think about. Then you design the use of the photo to help the person go in a little deeper. So you can apply this with any kind of situation, any kind of person, old or young, cultural differences, Alzheimer's, drug addictions, marriage problems, whatever. It depends on the therapist and what their goal is for that session. Now, in therapeutic photography, anything goes. Anybody with an idea of how you can help people by using photos, it works.